Hi, everyone, and welcome to the FLEX program training. I am Ashley O'Donnell, Clinical Improvement Consultant for the Iowa Healthcare Collaborative CAHPS program.
And I'm Lana, Comstock, Clinical Improvement Consultant for the Iowa Healthcare Collaborative CAHPS program as well. Together, we'll be providing your training today. Today, we're going to provide information that you identified as wanting to know more about. So in getting started, we're going to provide a high-level overview of the HARP data submission for QualityNet. Then we will provide information around HCAHPS. The Medicare Beneficiary Quality Improvement Project, MBQIP, focuses on quality improvement efforts in 45 states that participate in the Medicare Rural Hospital Flexibility, or the FLEX program. The program really provides the CAH the ability to evaluate their quality data and compare outcomes with the other CAHs. Hospitals report data in 4 areas: patient safety / inpatient, outpatient care, patient engagement, and care transition. CAHs provide health services to medically underserved patients. This next slide is going to show you the location of critical access hospitals in the United States. And you will see that Iowa has the second most CAHs nationally. In the MBQIP Flex program, with IHC serving as the prime contractor, we did want to assure that you are all aware that we have this contract for 3 full years. So essentially, it would go through 2022. The quality improvement works align with the hospital works that we already do.
All right, so next we're going to talk briefly about HARP. HARP replaces the Enterprise Identity Management account on the CMS Quality Payment Program portal and is what you will now use to upload your data. Per the QualityNet website, this new account access will offer enhancements such as one login. Upon implementation, the HARP system, you will no longer need to maintain multiple user accounts or login IDs. Instead, this will all be housed under a single account ID and will provide advanced security for modern systems to keep your facility's data protected. As IHC is the new MBQIP support contract holder, we work closely with Stratus Health and the Iowa Department of Public Health to assist with troubleshooting any potential issues with HARP, as well as all other areas of MBQIP. We wanted to voice today that we have been notified of some issues related to entering and submitting data, and we are continuing to notify the most appropriate contacts about these issues. We would ask in return that you make us aware of anything that does occur in the future as well. We recognize that some of this information may be repetitive. However, we did want to take this opportunity to introduce some helpful trainings for new users or quality personnel who may need a little assistance maneuvering the HARP account. CMS has listed the following training videos that relate to registration, user profile, password resetting, manual proofing, security official, and user rules. All of these videos are short and easy to follow step by step, and the link is provided in this slide. Here are some additional resources that may be helpful as you continue to work with HARP. QualityNet does offer a user feedback session, and you are able to request participation through the link above. They have a help desk with a ticket system to either email or call, and a frequently asked questions page on their main website. And as previously mentioned, IHC has been working closely with Robin Carlson at Stratus Health to brainstorm any resolutions to common problems, as well as the Iowa Department of Public Health. Keep in mind that as support contractors, we are unable to access the HARP account in itself, so there are some aspects we are not 100% familiar with. So with that being said, it is helpful to hear of any issues or concerns, as we may be able to assist, but also to track if there are any commonalities that need to be addressed within QualityNet. We will continue to provide any updates or education on HARP in the future, and please reach out to your clinical improvement consultant if you have any needs we can assist you with.
The Centers for Medicare and Medicaid Services, CMS, and the Agency for Healthcare Research and Quality, AHRQ, developed the Hospital Consumer Assessment of Healthcare Providers and Systems Survey, HCAHPS. The survey is administered throughout the year to a random sampling of patients. Intake survey results. From the Iowa Healthcare Collaborative's intake survey that was sent to you at the start of our Flex program contract in February of 2020, as seen in this slide, the results reflect that most of Iowa CAHs do collect and report HCAHPS data. From this group, most utilize a vendor to collect and report HCAHPS. Press-Ganey is the #1 vendor, followed by NRC Health. The hospital consumer assessment of healthcare providers and systems focuses on the customer experience. So it's really important to remember that this is not a customer satisfaction survey. It is, however, a 29-item instrument that is administered between 2 and 42 days or 6 weeks following discharge from the hospital. There are actually 4 approved methods for administration of the instrument. These include by mail, telephone, a mixed administration that can be mail and telephone, or an interactive voice response. Most of our Iowa hospitals are using Press-Ganey, and that is sent and then received via the mail. There are 3 broad goals that have shaped HCAHPS. First, the standardized survey and the implementation protocols actually produces data that does allow objective and meaningful comparisons of hospitals on topics that are really important to patients and consumers. Secondly, public reporting of HCAHPS results create incentives for hospitals to improve their quality of care. And thirdly, public reporting enhances accountability in healthcare by increasing transparency of the quality of hospital care provided in return for the public investment. Data results are shared on CMS Hospital Compare website. The site has 6 composite measures, 2 individual items, and 2 global items. Each of the 6 composite measures is constructed from 2 or 3 survey questions. Combining closely related questions into composites really allows consumers to quickly review patient experience information while increasing the statistical reliability of those measures. The 6 composites summarize how well nurses and doctors communicate with patients, how responsive hospital staff are to patients' needs, how well the staff communicates with patients about new medications, whether key information is provided at discharge, and how well patients understand the type of care they are going to need after they leave the hospital. The 2 individual items address the cleanliness and quietness of patient rooms, while the 2 global items capture the patient's overall rating of the hospital and whether they would recommend it to a family and or friends. Hospitals' survey response rates and the number of completed surveys are also publicly reported. This slide shows a new change from CMS, which has resulted in an actual new web page to find various entities to compare scorecards. So this is where you're now going to find the Hospital Compare site as well. And this new address is at the top, but it is medicare.gov/care-compare. Again, the address is medicare.gov/care-compare. HCAHPS scores are based on 4 consecutive quarters of patient surveys. Thus, the reporting is completed 4 times per year. The oldest quarter of this survey does roll off as soon as the newest quarter rolls on. And hospitals must have at least 25 completed surveys in a 4-quarter period in order for the HCAHPS results to be publicly reported on CMS Compare website. CMS believes that an ongoing review and evaluation is vital for the HCAHPS to continue to fulfill its mission in provision of national standards for collecting and reporting publicly the patient experience. Hence, they are actually in the works of planning a multifaceted review of the survey over this next coming year. The plan for this review includes talking to recent patients to identify their hospital experience and from their perspective to find out what's most important. So there will be more to follow on this. HCAHPS Online is a great resource for you to obtain information. You can see from this slide, in the first section of their site, this is where you can learn what's new. You can identify facts around HCAHPS, and you can learn how to improve the patient experience, to name a few. The link of the HCAHPS website is in this slide, but we also have listed this site in a reference slide so you can readily find it along with the other resources that we mentioned. Lastly, I want to share with you the new reports that the Iowa Healthcare Collaborative has developed around your HCAHPS results. And this is just a sample screenshot of the report that was sent from us. And it shows the quarter 4 of 2018 to quarter 3 2019 data. Each composite area is actually shown, and there's a really nice legend to demonstrate the star ratings with the details for each composite rating. Please know that we do recognize data is very old, and we continue to communicate with the Federal Office of Rural Health that we would like to get some assistance to try to obtain the data a little more timely. So then in turn, the Iowa Healthcare Collaborative can send these reports out to our hospitals. And this is the resource list for the HCAHPS information. We'd just like to thank you for your time today and your efforts to improve quality with the Flex and Equip program. And this is the slide of our IHC Hospital Team. Thank you.